Hello everyone. It's time to start our webinar today. And good afternoon, and thank you for joining us today for our TDR Global Research Mentorship webinar series. My name is Trisa Silestari. I'm the coordinator for this research mentorship webinar, brought to you by TDR Global and the Center for Tropical Medicine at Gadjah Mada University. Today, we will be featuring implementation research proposal development with a case study from Leprosy Control Program in Indonesia. I will start our webinar with some housekeeping. All attendees line are on mute, and please turn off your video. And then attendees, you can pose questions throughout the webinar. Please enter it into the Q&A box at the bottom of the Zoom screen. We will have a designated session for Q&A after all presentation, but please feel free to post questions or comments throughout the webinar. We will try to answer these as we move along. If you have questions after the webinar, you can email tdrglobalasia@ugm.ac.id. A link to download the proposal presentation file will be available in the chat box after the presentation. And we are recording this webinar, and it should be available within a week at the Center for Tropical Medicine website. Enhancing mentorship is a priority for TDR Global. TDR Global community aims at connecting, networking, sharing experience, and trying new methodologies to foster collaboration between people associated with TDR and beyond. And we design a virtual mentorship program where we can connect junior TDR global researchers with senior researchers and experts in the field to create positive impact on infectious disease. And research is always start with a proposal. In today's webinar, we're going to talk about developing an implementation research proposal using a case study from Leprosy Control Program in Indonesia. Of course, we will not have time to talk about the whole proposal in detail. For those who already took an implementation research course, this is a good opportunity for you to refresh your knowledge about implementation research. And for those who are not familiar with Leprosy program, we believe that there will be key messages that are relevant with your research field. And this research mentorship webinar series, we invite TDR Global member from Asia to present their research idea, concept note, proposal, methodological issues, or sharing the challenges in conducting research. Relevant expert in the field will then be identified and then invited to the webinar to provide relevant learning materials and feedback for improvement. If you are interested to actively participate in this webinar series, you can send me an email to tdrglobalasia@ugm.ac.id, and we will discuss your idea. And we are also aware that we have many experts and mentors in the audience, so please do not hesitate to give feedbacks for this proposal or to answer questions in the Q&A box. And if you are participating as a mentee, we also encourage you to post your question to the speakers. And today I'm very happy that we have Pascal Launois with us. Pascal is from the TDR headquarters, and he manages projects and initiatives to strengthen research capacities at institutional level and also the career development fellowship program at the TDR. So before we start the presentation, I'd like to invite Pascal to welcome everyone here and explain why TDR Global is interested to enhance research mentorship, particularly in low and middle income countries. Over to you, Pascal.
Thank you very much. So first of all, thank you to invite me to this TDR web seminar. So I would like to, on behalf of TDR, just to welcome half of you who are attending this meeting, which is an important one for TDR. Because for TDR, I'm pretty sure that you know the special program for research and training in tropical disease. I think we are working on infectious disease of poverty since now more than 40 years. And we moved recently to what we call implementation research. And if we have developed, and particularly in my unit, which is research capacity strengthening unit, a package of training courses on implementation research. I'm pretty sure that all of you are aware of that. I think what is really lacking in the TDR portfolio is mentorship, is how a senior, I don't like this word, but it's like that, a senior scientist can help a junior one just to be more effective, I could say, to develop greater confidence on what he is doing, and which is important for implementation research is to take better decision. Is the reason why through the TDR Global, which is a community of scientists, passionate scientists related to TDR, we have this series of seminars for Asia on mentorship, because we think that mentorship is really, really an important component of the training and the training of researchers from the region. So I will stop here just to say that in addition to the mentorship, I'm quite happy just to attend this meeting, because I started my career in research working on leprosy. I work on leprosy in Western Pacific, in a small island, a French small island in New Caledonia, and then in West Africa and Senegal. So I know leprosy, which is a really neglected tropical disease, and I'm really happy that both the mentorship and leprosy are linked, and that it will be a great effort just to control leprosy in Asia. So thank you very much for all of you attending this meeting.
Thank you, Pascal. It's good to know that you also start your career from leprosy. Thank you for your explanation. That was very helpful. So now I have the pleasure to introducing our speakers for today. We have 4 speakers for today. Our first speaker is Hana Krismawati. Hana is a researcher at the National Institute of Health Research and Development based in Papua, Indonesia. She has kindly shared with us an implementation research proposal on impacts of COVID-19 to leprosy program. Her research proposal has gained support from the Ministry of Health, so hopefully it can be done as scheduled. And even though we use leprosy program as an example, I believe other disease control program are also facing similar issue with this pandemic. So thank you for sharing your proposal, Hana. And for our second presenter is Dr. Yodi Mahendra Datta. He is the Vice Dean for Research and Development at the Faculty of Medicine, Public Health, and Nursing at Universitas Gadjah Mada. And he is also the coordinator for implementation research course organized by TDR Regional Training Center Asia. And in today's webinar, he will give feedback to the proposal from the implementation science point of view. And thank you, Pak Yodi, for your support. Our third presenter is Professor Dr. Hardianto Subono. He is the expert committee for Leprosy Indonesia and professor in dermatology and venerology. He's been involved in the leprosy control program in Indonesia for a long time and has made important contribution for leprosy control program in Indonesia. So today we will hear his feedback for the proposal from the leprosy program point of view. Thank you for your availability, Professor Hardianto. And our last presenter will be Professor Jan Hendrik Ricardus. Professor Jan Hendrik is a professor in infectious disease control at Erasmus MC, Department of Public Health, Rotterdam. He has more than 100 publications on leprosy, and today we will hear his feedback about monitoring and evaluation of a disease control program. I really appreciate you taking the chance to join us today. Thank you, Professor Jan Hendrik. And without further ado, I'd like to give this floor to Hana to present her proposal. So over to you, Hana.
Okay, thank you very much for your introduction, Dr. Trisasi. Yeah. Okay. Would you like to share my screen? Yeah, thank you. Yeah. Okay, distinguished mentors, TDR global members, and other participants, depend on where you are. Good morning, good afternoon, or good evening. Thank you for giving me this opportunity to share our research proposal about assessing the impact of COVID-19 to leprosy control program in Indonesia. Last January, I attended the implementation research workshop organized by TDR Regional Training Center Asia, and I become interested in implementation research design. This proposal is still in progress, and I really appreciate your comment and suggestion for improvement of this proposal. Okay, next. Oh no, and the second slide, please, Dr. Sasi. Okay, yeah. Yeah, as we know, leprosy is a very neglected tropical disease and also the ancient disease, but until now, leprosy is still a public health problem in Indonesia. According to WHO, Indonesia contributed 8.2% of leprosy cases to the world in 2019, with more 70,000 new case detection and ranked third after India and Brazil. In 2019, the prevalence 0.73 and case detection rate 6.04. Then to combat the leprosy, the MOH implement many interventions such as active case finding, chemoprophylaxis, and multi-drug therapy supply. However, Indonesia, like the other country in the world, recently we are facing the COVID-19 pandemic. The first case of COVID-19 was announced on March 2020, and currently we have more than 200,000 confirmed cases of COVID-19. Okay, slide 3, please. Next. Yeah. Due to the condition, of course, delivery of the healthcare services are affected, including leprosy, since many primary healthcare were closed or limit their services due to the infected health worker and social distancing rule. Host-to-host visits were limited, and therefore active case finding activity also delayed. The situation, of course, become a challenge to reach the national elimination target in 2030. Next, please, Dr. Sasi. Then to respond to this pandemic, in June 2020, the Ministry of Health released a new guidance for leprosy care. In this guidance, it contains 10 recommendations such as to help active case finding and preventive treatment, continue diagnosis and treatment for leprosy patient, and staff must use the appropriate PPE. Give MDT drug supply for 2 until 3 months to reduce patient visit. Perform neurological tests every 3 months. Then for patients who receive the corticosteroid, they should be follow up. Effective reconstruction surgery should be postponed. Logistic supply should be monitored and requested early to prevent stock out. Then stigma and marginalization of leprosy patients should be prevented. And the last, of course, and leprosy staff should also be able to provide information about prevention of COVID-19. Okay, next. Yeah, so this is our implementation problem statement. Intervention for leprosy prevention and control have changed due to COVID-19 pandemic. The Ministry of Health and WHO have released new guidance for leprosy prevention and control in the pandemic, but implementation of the new MOH guidance have not been evaluated, as well as the impact of the pandemic to leprosy control program. Next. So in this study, we tried to combine these two frameworks to evaluate the process outcome. We will adopt the pandemic health system framework by Lazarus et al. Using this framework, we can evaluate how leadership and governance, health workforce, information system, medical product, and technologies, financing, and service delivery were performed during the pandemic. And to assess the outcome, we will use the implementation outcome framework from Proctor et al. This framework contains implementation process and client outcome, implementation process and client outcome. But in this study, due to our limited resources, we will not assess financial aspect of the program and client outcome. Okay, next please. Yeah. So this is our research objectives. First, to assess acceptability and feasibility of the new national guidance for leprosy control during pandemic. Second, to measure the impact of COVID-19 to leprosy staff. Third, to assess quality of leprosy data during the pandemic. Fourth, to assess availability of drugs and other health supplies for leprosy program. Fifth, to measure implementation fidelity of the new leprosy guidance. And the last, to measure the impact of COVID-19 to leprosy program indicators. Yeah. Okay, next, yeah. And this is our research method. Yeah. In this study, we will use quantitative design using cross-sectional survey and retrospective cohort analysis. Our setting is district that still have leprosy cases. In Indonesia, we have 341 districts in the record. And our target population is leprosy coordinator in eligible district. We will use total sampling technique, but we will exclude those who was assigned as coordinator for less than 3 months. For data collection, we are planning to use online survey method using the Google Form platform. And ethical clearance will be sought from the NIHRD Ethical Review Board. Okay, next please. Yeah, okay. So this is our sample questionnaire. I will not read them all, but you can read from the file. You can find it in the chat box. First, to assess acceptability and feasibility of the new leprosy national guidance in pandemic, we will measure leadership and governance, policy adoption at local level and other resources. Then our proposed questionnaire will be whether they have received the new guidance, whether they get support from the local authority to implement the new guidance. If yes, then how many recommendations they can implement. And also we will ask if there is a local specific policy on leprosy during this pandemic. Okay. Yes, next. Okay, this is second, yeah, second objective. To measure the impact of COVID-19 to leprosy staff, the proposed questionnaire will be whether they are involved in COVID-19 response team, if there is any change in their working time spent for leprosy control. We will also collect information about whether they have received any training related with COVID-19 and specific training on COVID-19 and leprosy. Then we will ask if they are confident that they can practice good infection prevention and control when providing care to leprosy patient, and whether they have been screened for COVID-19 disease, of course. Yeah, okay. Yeah, for the third objective. Our third objective is to assess quality of leprosy data during the pandemic. Then our proposed questionnaire will be, were they able to report leprosy data as scheduled? And were they able to maintain data accuracy during the pandemic? And did they meet any difficulties to access the leprosy database or information system? And the fourth objective is to assess the availability of drugs and other health supplies for leprosy program. We will ask about the availability of MDT, rifampicin, and steroid for the next 3 months. If they don't have enough drug supply, have they sent a formal request to the provincial health office? We will also ask if they have enough leprosy healthcare staff and if they have enough PPE to serve leprosy patient in this pandemic era. Okay. Next. Okay, this is the fifth objective. Yeah, thank you. Our fourth objective is to measure implementation fidelity of the new leprosy guidance. So we will include all 10 recommendations in the new guidance in our questionnaire. Okay. Yeah, the last objective. Next, please. Yeah, okay, thank you. And for the last objective, to measure the impact of COVID-19 to the leprosy program indicators. We will use cohort data and calculate number of leprosy cases in 2020. How many cases lost to follow up during the pandemic? Are there any district that can perform tech investigation and provide preventive treatment to contact? And we also want to know if leprosy staff are able to monitor their patients and identify reaction. Yeah. And next, please. So this is our data analysis plan. The data will be analyzed using SPSS software to perform the simple descriptive analysis. We will generate demographic profile of the respondent and calculate program indicators. Then we are planning to measure association of response with district characteristic, for example, leprosy elimination status and location. Okay, next, please. Yeah. So this is our time plan of study. We just started with proposal writing this month, and we are planning to collect the data in November. Hopefully, we can finalize this study in December and disseminate the result in January next year. Yeah. Next. Yeah. Okay. So this is the last. Yeah. I hope this presentation can give you an overview of what we are planning to do to evaluate the impact of COVID-19 to leprosy program in Indonesia. I welcome any comments or advice to improve this proposal so that we can do better program evaluation and have a better impact for leprosy program. So thank you very much for your attention. Yeah.
Yeah, thank you, Bu Hana, for your presentation. It's indeed an interesting project. I will share I will share the link to download your PowerPoint slide first. You can find it in the chat box. I just recently posted in the chat box, so those who want to read more about this proposal, you can, or about the questionnaire, you can find it in the a link to OneDrive file. Yeah, so you can download it, or you can find the link in the Zoom webinar chat box. So now I would like to give the first opportunity to Pak Yodi to give his comments and feedbacks to the proposal.
Okay, can you hear me, Sasi?
Yes, clearly.
Okay, thank you. So good afternoon, everyone, especially to Bu Hana. It's good to meet up again after so many months.
Thank
Bu
you.
Hana, even though only through Zoom, but it's good to be able to link up. So first of all, congratulations for managing to develop this IR proposal, which is not an easy proposal to make. Yeah? Perhaps I just share a bit of background details for the other participants. Bu Hana here, as she mentioned, she followed our IR training in January. So that was only several months ago. And her background is actually not a public health researcher. She's a biomedical scientist. That's correct, right, Bu Hana? So
Yes, right. Yeah.
she comes from the lab. She comes from the lab, but she has a huge interest on IR, and she followed the training, and she actually managed to develop this proposal as part of an outcome of that training. So it's quite a learning leap, yeah, that from a biomedical scientist being able to actually write up an IR proposal like this. So that's a big achievement. But that's also to emphasize one important element of IR is that by nature it is multidisciplinary. So even though you only see Buhana's name on the cover, there's actually a team behind that, right, Buhana? So there are several people who's working on this, coming from different backgrounds, which are relevant and required to be able to carry out this IR proposal. So that's one element that I would like to emphasize, that by nature, IR is teamwork, and it requires people from different discipline, because the issues that you're going to deal with is cross-disciplinary. So you have to bring in all of the right people on board, and Buhana has those team around her. So we're happy that she's come this far with her team to develop this proposal. Now, also to highlight, this proposal is especially important also from an IR perspective in general, because it's not just any IR proposal. This one is related to the COVID-19 pandemic. Yeah? And there is actually a very big need for IR during this pandemic. Yeah. But we have not seen much of implementation research being carried out during this pandemic. So it's really encouraging for us to see this proposal coming out, an implementation research proposal, which is related to COVID-19. So my hope is that this proposal and this webinar in general could actually also contribute to promoting IR for COVID-related issues, which is much needed. So hopefully we'll see more proposal, more studies to see more contribution of IR for COVID-19. So those are general remarks. Now, coming back to the proposal, which Bu Hana already presented. So in general, it's already following the standard principles of IR, the templates of IR proposals, which is out there. You can check out that there are many guidance to write a proposal development. Here, usually because we refer to the TDR toolkit or other guidance from WHO TDR, because that helps to actually structure the proposal, and that's what Bu Hana is using. Now, if we go section by section, just to highlight what's important in terms of IR. So one of the most important part of this proposal is the problem statement and the research question, because that's the heart of the proposal. In IR, we see or we say that the research question is king because it determines everything else. Now here, the point is we need to really make sure that we come up with a problem statement or research questions which is actually relevant to the field or relevant to the implementers, that this doesn't only come out from an academic interest, but it actually comes out from an implementation challenge. So here, what we need to see is actually how was this problem statement and the research question formulated. Now, I'm assuming in the PowerPoint it doesn't show because it has to be short and concise. But in the full proposal, we need to see in the process, for example, it should be presented that based on discussion with the implementers, the program managers, these were the things that come out so that people are convinced that this is not just something coming out from the researcher's interest, but really also has been discussed together with the implementers. So I'm sure that's not difficult, and I'm sure Bu Hana has done that, but it's just, it didn't come out on the presentation, perhaps because the time was limited, but that's what important aspect of IR. We need to ensure that it's really relevant to the people in the field, to the people implementing it, because it will not just stop in the conclusion. It will actually, whether it's successful or not, will be judged whether it actually contributes to improving implementation. And to be able to improve implementation from the beginning, we have to engage the implementer. From the beginning means from the formulation of the problem statement. So we need to see more of that. Yeah. So I think that's not too difficult to actually address and to make sure that shows up in the proposal. Now, another aspect of IR, which is also quite unique, is that in the past few years, there are so many theoretical frameworks of implementation research, which we could actually use. Now, here, what Bu Hana actually presented were two frameworks. Well, actually, it's one. The framework was Pandemic Health System Framework, while the other one was implementation outcomes. Now, the implementation outcomes itself is the focus of IR. Yeah? So if we're doing IR, then we need to be very explicit what are the implementation outcomes that we are focusing on, what implementation outcomes that we want to improve. Yeah? So, but that has been presented in the PowerPoint. Now, what we need to know is the considerations to choose the pandemic health system framework, which is a nice framework, but it has to be justified because there are other frameworks which perhaps could explain better the implementation outcomes which will be studied in the proposal. So whether it's the CIFIR framework or other framework, but we just need to see whether you've done your reviews, that you've considered other frameworks, and you finally decided on the pandemic health system framework, for example. So that part, again, is something for the full proposal document, which we hope we can see when we get to that document, that you've actually reviewed several frameworks, but you decided on this particular framework after considering the other frameworks, that this is the best framework which explain or could actually help you to think about the problem statement. Okay, so that's more of trying to explain why you actually decided to use the frameworks. Okay, now another part which is also important in IR, not just in IR, but also in any studies, is actually we need to show efforts to ensure data quality. We need to show efforts to show that the data that will come out of this study is credible, that it's valid, that it's reliable. Yeah? And that hasn't really come out also in the presentation. Maybe it will come out on the proposal again, maybe it's because of time limitation. But this is a critical part for most reviewers to convince that the data is good. The data will be of good quality. So we need to show some of the efforts there. What are the efforts to make sure that the quality of the data which is coming out of the study is acceptable? Yeah. So just write up the strategies there so that when people read it and people can be convinced, okay, this is going to be a good quality data. Yeah. Okay.
Yeah.
No, so that's on the method part. Now, another point which usually doesn't come out in other proposals, but really is important in IR, is also dissemination plan. How do you actually plan to disseminate the study? Yeah? In other studies, it's usually not part of the proposal, but in IR, we need that because it doesn't end with the study report. It should at least go through disseminations so that we make sure that it reach those who are going to be considering it for implementation. So we need to also have a section on these proposals about dissemination strategy. Which would be important to make sure that this study will not just be an academic exercise, but will actually be disseminated to the implementers. So to have some thinking of who are the target users, the implementers, what are the media that they usually rely on for informations, and so how you're going to strategize to make sure that your result would reach them. Okay, so that's that's usually at the end, nearing the end of the method sections. Now another part.
Pak Yodi, you have 30 seconds.
Okay.
Left.
The last 30 seconds is also in R is important to show that you actually engage the stakeholders. Yeah? So throughout, then try to show how the stakeholders are engaged throughout the study plan so that you can actually show that this is co-formulation, co-development, co-production of knowledge. That's 30 seconds. So congratulations again, Bu Hana. Looking forward for the revised proposal. Thank you, Bu Sasi.
Yeah. Thank you, Pak Yodi, for your feedbacks. Very important feedbacks for Bu Hana to revise her proposal. And now we move on to our second expert, Professor Hardianto. He has shared a presentation file. I will share the presentation file. Can you see that? Prof. Hardianto, please, the time is yours now. You have 10 minutes to give feedback to Bu Hana and the team.
Okay, thank you very much, Bu Sasi. And thanks for inviting me to be one of the presenter in these nice seminars. And ladies and gentlemen, first I would like to congratulate to Ms. Hana Krismawati, who has been presenting her slides, the proposal, very excellent. I knew Hana since some years ago when I was invited to be speaker in her seminar as well in Leprosy. And this morning also, we have been discussing about project proposal for clinical trial for a new case of leprosy in Papua. So I think our collaboration with Hana is quite a long time. So actually, as the presentation is quite complete and good, although has been commented by Yodi. So actually, I don't know what should I comment. But I would like to start from the beginning. What is leprosy and what COVID-19? So the next slide, Pusasi.
Slideshow, Pusasi.
Yeah, slideshow. Yeah, leprosy is an infectious disease, the chronic infectious disease caused by infectious bacilli we call Mycobacterium leprae. While COVID is acute disease, infectious disease, which is acute, caused by coronavirus, SARS-CoV-2. And in terms of the diagnosis, leprosy is much easier than COVID-19 because just using clinical pictures, like skin patch with loss of sensation and enlargement of peripheral nerve and finding of infectious bacilli in the skin smear is quite enough. So we don't need actually to use or to perform more advanced clinical laboratory examination like PCR or something like that. Clinically, we can diagnose leprosy quite easy. But of course, we have to face to face with the patients. While diagnosis of COVID-19 is a little bit difficult, although clinical picture very non-specific, as reported by current publication as well, that clinical picture can be a variety from just low-grade fever until the severe one with pneumonia. But usually we need PCR to confirm the diagnosis of COVID-19. Then, in terms of the prevalence in Indonesia, recently reported, yesterday, it was reported that the number of confirmed cases is about 225,000 patients infected with COVID-19. While leprosy, the prevalence of leprosy is only 18,000. Yeah, you know, it's very low actually, although Indonesia is ranked in the third in terms of the number of places in the world after India and Brazil. But the disability rates for leprosy is still quite high. And the disease is also endemic in almost 34 provinces, all the provinces in Indonesia. The highest one is in Papua, then South Sulawesi, and so on, while in Java, relatively low. And COVID-19 as well, I think COVID-19 is also already infected in all the provinces in Indonesia, with day by day, the number of disease increasing. Could you share in the slideshow?
Bu Sasi, bisa tolong di slideshow?
Yeah, wait. Maybe
Okay, if not, then I'm just talking. So, is there any relationship in terms of
Can you see the slide now?
Not slideshow.
No,
slide sorter.
Slide
sorter.
Oh, wait.
So the question is, there any relationship between two diseases? One, in immunological point of view, I don't think if there is a relationship between these two diseases. In other words, there is no cross immunity because leprosy is protected by cellular mediated immunity, while COVID-19 by humoral or antibody mediated immunity. In terms of the clinical outcome, there is also no clinical overlap. Leprosy usually resulted in disability, and COVID-19 usually ended with mortality. So there is two different outcomes of these two diseases. But in the control program, of course, as also in other diseases, COVID-19 may influence, big influence to the disease control, other disease control like tuberculosis and also leprosy. For instance, in the management, in areas or activities of the leprosy control, the priority of the government, the stigmas as well can be different between two diseases. In the past, leprosy was highly stigmatized by community, by people. But now, many people even stigmatize COVID-19. And of course, last but not least, in terms of the funding, of course, the funding from the government, I think the majority of the government in the world are now focusing on controlling of COVID-19 compared to chronic diseases like leprosy or tuberculosis. So because of the promotion that to prevent COVID-19, we have to avoid close contact, cleaning hands, and using masker, and so on, and stay at home, and so on. So this, of course, this will influence the leprosy control day by day. Yeah, as mentioned by Hana also, our leprosy, the global leprosy strategy, so we have to stop infection, stop leprosy and complication, and the end in 2030, we hopefully to have leprosy world. So as shown in the global leprosy strategy, the vision is zero disease, and it should be this year actually 2020, and zero transmission of leprosy infection, zero disability due to leprosy, zero stigma and discrimination, and the target of this global strategy is decreasing all indicators, including the number of children diagnosed with leprosy should be zero in this year actually, but can be extended maybe another 10 years. And the rate of deformities also should be less than 1 per million population, and number of countries with legislation from the government allowing discrimination on the basis of leprosy. So there are some areas which leprosy control program may be influenced by COVID-19. For instance, in case detection or early case detection and finding, then the treatment, prophylactic intervention, and risk of disability and stigmas. And also mentioned by Hana is about leprosy health workers, leprosy workers. And also in terms of logistic, and of course cross-sectoral or cross the organization coordination, which may be also influenced by COVID-19. About social discrimination, as we notice every day that there is refuse also for COVID-19 when they are died. So this is an example that stigmas of the COVID-19 is much severe than leprosy in the past. So the conclusion of this topic is the influence of COVID-19 to leprosy. In early case detection, possibly early case detection will be decreasing during the COVID-19 pandemic. The treatment, probably they will be increasing in the uncompliant patient because, you know, leprosy needs to long-term treatment by using multi-drug therapy. But the problem before, even before COVID-19, was the compliance of the patient to treatment. They should come to the clinic every month to take the blister of the MDT, but sometimes the loss of, they not comply to this regulation. Also the prophylactic treatment possibly will be decreasing because, you know, we are now have been implementing prophylactic treatment in certain population in East Java by using, let's say, rifampicin monthly. But probably because we have to monitor the population, we have to monitor the patient, and as the COVID pandemic, probably the monitoring of this prophylactic treatment will be decreasing. Also, the risk of disability of the patient may be increased because, you know, the reaction which occur during the treatment and the damage, of course, will be neglected by the patients and no supervision from the health workers. But stigma of leprosy may be less compared to COVID-19 now. And about leprosy workers, less number of leprosy workers now, because all the health workers probably will be activated, will be focusing on COVID-19. The logistics also very important. So, you know that even before COVID-19, sometimes the MDT hardly to be found in the clinic. So during COVID-19, probably, I don't know, I don't hope it that logistics, especially the availability of the MDT will be decreasing because it may not be priority from the government. And of course, also the cross-sectoral coordination probably will be less because all the activities will be focusing to COVID-19 control. Okay, I think this all my short comment because I'm sorry that at the beginning I don't know what should I say. It's not so clear. So, but I hope this will give you overview of the leprosy control in general before COVID-19 and also the possible impact after the COVID-19 in the leprosy control. Okay, thank you very much.
Yeah. Thank you, Prof. Hardianto. And I'm so sorry for the technical glitch. I forgot to enable editing the slide, but is it okay to share your slide to all participants? I can share it
to... that will be okay.
Yeah, okay. Thank you very much, Prof. Hardianto. And Bu Hana, I hope you can take into consideration all of this concern about link between COVID-19 and leprosy.
Yeah.
And now, I would like to invite Professor Jan Hendrik to provide or to give his feedbacks to this proposal. Now, time is yours, Prof. Jan.
Yes, thank you. Hello, everybody. I'm following this seminar with great interest, and I really would like also maybe in particular congratulate Hana for an excellent presentation, an excellent proposal. And my task is not to give a formal presentation, so I have none, but to just reflect on a number of things that I noticed that I would like to mention. And maybe it is possible as I speak that you put up the slide from Hana's presentation on with the 6 boxes. I think there were 6 boxes with the project objectives. That helps maybe a little bit to visualize what I want to say.
Okay.
Anyway, I think this, of course, is a very important and timely research project. implementation research project. I'm not aware of any other countries who are so advanced in taking this opportunity of looking into the implications of the COVID pandemic on leprosy control. And I'm sure this is not just relevant for leprosy control, but for all NTDs and all disease programs. So it is very important. Now, what I see is that there are different levels, and I don't want to comment in detail on all the methodological issues. Dr. Yodi has made a very clear presentation on that. But in general, I see that you will be reviewing the short-term effects of the COVID pandemic on the leprosy control program in terms of many operational issues, and with in mind that you would like also to make the necessary repairs as much as possible. So at least to counter some of the worst effects of the COVID pandemic on the actual leprosy control program. Apart from that, there's also the possible long-term, what I call fallout of the COVID pandemic on the leprosy control program. So what happens now, or what maybe does not happen now in the leprosy control program, will have effect on the program, on the health workers, and particularly on the patients and their contacts in long term. And it would be very good to actually also try to get a picture of that. But at the same time, I see a research proposal like this also as a stress test. What we're seeing is that the pandemic is providing a lot of pressure on the whole health systems, in fact, on the whole of society. But if we just focus on the leprosy control program, it'll actually bring out the weak points. So it's like putting pressure on a pipeline, and the weak points that they will burst, they will start leaking, etc. So a research undertaking like this will also reveal the weaker points of a program under stress, and highlighting these points will also help in future to improve the program in general. So also this aspect, the evaluation of this aspect, I think is very important, not just focusing on the immediate effects of the pandemic on the program, but also viewing this whole situation as a possibility, as an opportunity actually to improve the program in the longer term. So that's just a general remark. When I look at as a supervisor at research proposals, I also not just look at the context, but also at the timeline. And I always try to visualize if all the plans that are there are made, or the whole proposal, if that actually is feasible within the timeline. And here I kind of get a little bit, say, concerned, because you have a very, very short timeline and a very ambitious proposal with many things. So I'm wondering if there's actually a good fit between the contents of your proposal and the things that you want to do, and the time that you actually have to do this. Depends, of course, on how many people are working on this besides yourself. So if indeed there's a larger team that are all involved, it may be a bit more feasible, but this very, very short timeline raises concern from the outside looking at that. If it's not possible to extend the timeline, you might need to look at making some choices in what you actually want to emphasize, and that's why I asked for this overview, the few slides back with the 6 research plan or research elements. So maybe you would want to not focus on all the details, maybe make a choice on which factors, which information, which data is most important to achieve the objective of your study, because you may not be able to do everything. So this would be my advice, just to look at that closely if it's feasible within the timeline. And then finally, I just want to make a pointer to a very important website. It's called InfoLab. I can give you the link, and there's a whole page on leprosy and COVID, and there has been a lot of information brought together. The WHO recommendations. There's guidelines and information from different countries. So I would recommend, as a good starting point, and maybe you already have all that information, but I recommend also for all the participants in the audience to use this InfoLab website, and particularly to look at everything that has been brought together on information on leprosy and COVID-19. So this is just my concluding advice, and I would like to just return the word to the chair. Thank you very much.
Thank you very much, Prof. Jan, for your very important inputs to improve our research proposal. Yeah, it is quite ambitious project. So maybe we can consider it again, Bu Hana, for the timeline.
Yeah.
And please, can you share the link to this info lab in the chat box, Prof. Jan?
Yep.
We only have 3 minutes left until we have to close this session. There's only one participant who already raised her hands. Ibu Rina, you have question, please do so in very short.
Yes. I just want to ask you about, is it difficult to implement in only one region? I mean, that's because I know in Jakarta that I have surveyed, there's also a lot of leprosy patient not continuing the program. Is it impossible to implement your questionnaire in that?
To whom you address the question?
I mean the group of the leprosy persons.
No, I mean to which speakers?
Oh, sorry, to Ibu Hana.
Oh, yeah, sorry.
Okay. Yeah, can you repeat the question again, please?
Yeah, and louder, please, because I cannot listen your voice clearly from here. Ibu Rina.
Sorry.
Yeah.
Sorry. I just want to ask you about, is it impossible to implement your instrument to the local person? Because when I see the questions in the questionnaire, because when I done research in Jakarta to the leprosy person, I mean the group of the leprosy people, lots of them are stop the treatment or stop the group when they are they conduct the treatment due to the stigma around the community around them. Thank you.
Oh, okay. May I answer the question directly, Dr. Sasi?
Yes, please.
Okay. Ibu, this questionnaire actually we will request this questionnaire to the leprosy program manager in the district, so not for the leprosy patient. So the respondents for this implementation research is not the leprosy patient, since we have to assess the process and the outcome of the program during this pandemic. So our target population is leprosy coordination in the eligible district that I mentioned previously. We have 341 districts that still have the leprosy cases in this area, in that area. So actually in this research study, our respondent 341 of the leprosy coordinator. Jadi wasor di kabupaten, Bu. So not the leprosy patient.
Thank you, Ibu.
Yeah.
Yeah, and Tilak, quick question, please.
Masih mute ya? Still muting.
Hello.
Yeah.
Hello.
Go on, Tilak. Yeah.
Yeah, please, Tilak.
Thank you, Bu Sasi and Pak Yadi, after a long time. So I just looking for the proposal. I have just one question. I'm just wondering, is the proposed question is suitable for the quantitative design? Because in the proposal, it was like a quantitative design, but in questionnaire, there are some question. I just wonder how it will be analyzed by the quantitative design. And also in the data analysis, one of the target is to calculate program indicator. What is the process or how we can calculate any program indicator? Thank you.
Yeah. Okay. Maybe I will answer first. Then, if maybe Dr. Sasi can help me to answer the question also. Yeah. Okay. So actually, beside the quantitative analysis, we consider to run also the qualitative analysis. Since this proposal is still under the development recently, that's why we need your input. Thank you very much for your input. Yes, I think we will consider beside the quantitative, we will do also the focus group, such as focus group discussion or qualitative study to collect the information from the leprosy manager in all districts. And maybe for the rest, Dr. Sasi, would you like to help me to answer this question, or Dr. Yodi?
Yeah, usually to measure program indicator, we will use programmatic data, so available data in the program, and there are several indicators for leprosy that already established. So actually, it's just a routine indicator calculation, but maybe Bu Hana will compare it the indicator before and after the pandemic.
Yeah. Just retrospective, as we mentioned before. Yeah.
Yeah. So and there's one question in the Q&A box, and probably this is the last question before we. There's another one in the chat box, but this is important question. So probably you can answer this, Hana. From Timothy John Dinson. In your methodology, you will use Google Sheet for data collection. How would you ensure that the target participant can share it? So you will share this Google Sheet to Leprosy Program Coordinator, right? So how would you ensure that they will answer this the questionnaire, and how can you verify that the answer are true? Yeah.
Okay. Thank you very much. It is very good question actually. Previously, before we develop this proposal, we have the meeting as Dr. Yodi explained before, that because this is like a multidiscipline and we have to involve the implementer for this study. So previously we asked for the involvement from the Ministry of Health, especially from the General Director of Disease Preventive and Control, and we make the commitment to run this study together, because in Indonesian leprosy control program nationally, the Dirjen P2P, Directorate General of Disease Prevention and Control Program, they have the resource to mobilize the mobilize all of the leprosy program manager in all district, because they have one platform using a group or annual discussion meeting virtually or offline. Before the pandemic, there is a routine meeting that mobilized nationally by Directorate General of Prevention of Disease Control of Indonesia. So when we developed the proposal, we asked for the involvement from the National General General of Prevention and Disease Control of Indonesia to involve the study. And then they have the task to mobilize the data collection of the study, coordinate and mobilize and ensure that all of the district's program manager can answer the questionnaire, can involve in this study. Yes, I think it is what we can do, or ensure that all of data we need we can get from the leprosy district program manager.
Yeah. Thank you, Bu Hana, for your explanation. So due to time, we cannot accommodate all of the question. Just to let you know that next month we also have another research mentorship webinar. So next month, the webinar will be co-hosted by the Faculty of Technology, University of Sri Lanka. We will discuss about issues in mentor and mentee relationship. So if you are a mentor, one of the speakers will be discuss about type of mentors and interesting relationship issues that commonly occurring during this mentor and mentee relationship. So I think this next month webinar will also be interesting. It will be held on October 14 at 3 p.m. Jakarta time or 1:30 p.m. Sri Lanka time. So hopefully we can see you again at our webinar series. And before I close this webinar, I would like to thanks to all TDR course contributors and all of you who already participate in this webinar. So hopefully we can meet again in our next webinar series. Thank you for your kind attention. Hopefully it's useful. See you again. Bye-bye.
Bye.
Hai, selamat Bu Hana.
Thank you. Terima kasih Dr.
Selamat,
Yodi,
Hana.
Prof. Har.
Thank
Ya,
you
Pak
for all
Tati.
Matur
participants,
nuwun,
Prof.
Prof.
Hardianto,
Har.
Matur
Pak Yodi.
Pak
Thank you for
Yodi.
all participants.
Yeah.
Terima kasih.